significant numbers. All of these things are remote signs. They will happen with increased frequency the closer we get to his coming. Remember, one of the ways the scripture explains and illustrates the rapture is the birth of the man-child. Think of pregnancy. Once a child is conceived, a number of things happen. Initially, things are happening, but the mother and her husband are not aware of it. Then, there are certain physiological changes that take place. They become aware of it. Obviously, pause of menstruation. Obviously, drinking water for two, taking in nutrition for two, and the bladder is pushed to the side by the growth of the baby in the embryonic sac. Urination becomes more frequent. Then there's morning sickness. Then eventually, in time, a fetal heartbeat is detected. Then there is lower back pain. Then the baby begins to kick around and move. It's progressive. You know the baby isn't coming right away with any of those signs. You just know its coming is getting closer. However, the closer you get, or the closer you get to the onset of labor, things become more. Now, there can be false labor. There can be what appears to be labor. And it happens all the time. Mother will go to hospital expecting the baby to be born, and they send her home. It's a false labor. However, in a medical emergency or in an emergency delivery, first thing obstetrician or paramedics are going to ask, or midwife's going to ask, has the water burst? Once that happens, you know the birth of the baby is imminent. Well, the rapture will follow that pattern, except for the Greek term kolobo, a surgical incision. We can think of the rapture as a cesarean section performed by the Lord. A cesarean section. For the sake of the elect, the time will be cut short. The baby, as it were the man-child in Revelation 12, will be taken out. In obstetric medicine, you can only do so much with epidurals. You can only do so much with an episiotomy. If the baby is in a breech position, if there's other medical complications, obstetrician says, that's it, we're going to do a C-section, cesarean section. We're not going to wait any longer. The mother can only take so much. We don't want to risk to the baby any more than is necessary. We're going in and get the kid out. We can think of the rapture in those terms. Kolobo in Greek. A cesarean section will take place. Now, I've explained these